Today we start talking about making jaw relation. First step of jaw relation is to check the trial denture base on the cast. The trial denture base, the acrylic crescent, should be extended to the full depth of the vestibule or the border on the cast. The acrylic crescent should be adapted. No air bubbles should be present at the acrylic. The borders are smooth and rounded, no sharp edges. In front of every frenum, the V-notch for each frenum should be cut. Now, I have to check the trial denture base inside the patient mouth. I have to check retention, extension, and stability. I will start with extension. To check extension, I have to retract the lip 45 degrees and visualize the border. By vision, it is fully extended to the full depth of the vestibule. While for the distobuccal and the buccal area, I have to check it digitally by my finger that it is properly extended. That's for the extension. What about retention? Every area I have to check it separately. The anterior area, I have to pull downward the trial denture base. It is retentive. For the buccal area on the left side, I have to apply vertical forces at the premolar area. While on the other area, on the premolar area, I have to check it by pressure on the left side. For the post-dam, slight pressure on the lingual side of the wax, it does not move outside from the post-dam area. Thus, the upper is properly retentive. What about stability? I have to apply alternative forces at the premolar area. There should be no rocking is present. By that, I have checked the upper for retention, extension, and stability. Next step, I have to check the aesthetics of the wax. But before working, I like usually to make my wax by myself. I will remove the wax. Then I will go to bring a piece of wax and make upper occlusion block. Checking the trial denture base for extension and stability and retention, I have to make the rim, the occlusion rim. I will take the wax and I start softening the wax. Usually for the upper, I take half of the sheet. The wax should be very soft with me so that I can roll it. Usually when I roll the wax, I start from inside to outside so that not to entrap any air bubble inside the wax. The wax should be very soft so that I can shape it and roll it over the cast. The wax is soft with me. I can roll the wax. At the crest of the ridge, I apply the wax. Then I start to roll and shape the wax over the arch, following the shape of the arch. If the arch is U-shape, I have to follow the shape of the arch. By my hands, I can apply some pressure for adjusting the labial part of the wax to give me some lip support. At the canine areas, I have to apply some pressure to make canine eminence. By my wax knife, I start to soften the wax and adjust the wax. I'm just going to seal the wax with the trial denture base. That's why the trial denture base should be dry and not wet, otherwise the wax will not stick to the trial denture base. The wax should end at the half of the tuberosity. I seal the wax so that there is no space between the wax and the trial denture base. On the palatal side, I'll also have to seal the wax properly. I place my occlusion block on the table to keep it stable. Then the anterior part, I just make the anterior occlusal plane parallel to the floor, just horizontal. And for the posterior part, just slight inclination, 1 to 2 degrees, not more than that. Otherwise, there will be excessive sloping, and I don't want any excessive inclination. Adjusting the wax outside the patient mouth is a very important step for having proper occlusal relationship or jaw relationship. While the wax is soft, I have to insert it in the water so that it hardens, so that no problem will occur, distortion to the wax occur. After removing trial denture base from the water, I will start my steps of jaw relation. First step of jaw relation is to check aesthetics of the patient. After extraction, the upper lip lost its support. Then my role is to return the proper aesthetics of the upper lip and for the patient face. I have extra oral landmarks that is guide for me. Before inserting the trial denture base, if we see the nasolabial sulcus is deepened, if we come from side view, you can see that the vermilion border is unsupported. You cannot see the vermilion border. The vermilion border is invisible. Okay? I will take the vermilion border as a guide for me so that when I insert my upper trial denture base inside the patient mouth and to look the patient from side view, you can see that my vermilion border now is supported. You can see the vermilion border. This gives me proper support. My patient face is not stretched and not wrinkled. But if we see that the left side is more supported than the right side, I have to decrease a little bit that side on the wax. You can see that the wax on this side is more added than the other side. So I start to reduce my wax. I reduce the wax so that the wax on each side is identical and not to lose my support, just slight reduction of the wax. I take the trial denture base and back to the patient's mouth. You can find that the lip support on both sides is nearly the same. Proper vermilion border can be seen now. After adjusting the lip support, I have to shift to the second step, which is orientation of the occlusal plane. anterior and posterior. To check the anterior occlusal plane, I have to check it inside the patient mouth for two things. First, for direction of the occlusal plane and the height of the occlusal plane. For the height, the orientation of the anterior occlusal plane should be below the upper lip by 2 millimeters. If you see, افتح كده شوية حاج. On slight movement, there is 2 millimeters showing from the wax, from the upper lip. That's good for my lens, for the lens. What about the direction? This is for aesthetics. It should be 2 millimeters below the upper lip. What about second thing to check it is for phonetics. When the patient say letter F, the lower lip should touch the upper lip or the occlusal plane of the upper. نقول ف؟ قول يا حاج ف؟ هتلاقي lower lip touch the upper lip and the upper occlusal rim. So my lens is properly checked by aesthetics and phonetics. This is for checking the orientation of the anterior occlusal plane. What about the direction? I will get my ruler or wooden stick and apply it on the occlusal plane anteriorly. This should be parallel to the interpupillary line. But if you see, it is a little bit inclined toward the right side. So I have to correct this side, or the right side, to reduce the wax from it. Then to check it back in the patient mouth. Let's start to reduce the wax because the height on this side is higher than the other side. I insert the wax again in the water to harden. Then I will go to the patient mouth. I insert the trial denture base. I place the wooden stick and it is now parallel to the interpupillary line. The interpupillary line, to remind you, is an imaginary line passing through the two pupils of the eyes of the patient while looking forward. Now it is parallel to the interpupillary line. Thus, the anterior occlusal plane is adjusted by aesthetics and phonetics and parallel to the interpupillary line. What about the posterior occlusal plane? I have to insert my stick and look. The patient, I have to get another stick. The occlusal plane posteriorly is parallel to the ala tragus line. Ala tragus line. This is the ala tragus line. And if you see, the wax need to be removed from the posterior area. I have to remove some wax posteriorly. I start to reduce the wax slightly from the posterior area so that I don't have a steep slope. I don't need a steep slope. It is 1 to 2 degrees, that's that, not more than that. Otherwise, I will have a steep curve. I don't need a steep occlusal plane. I'll go back to the patient mouth. I insert the upper trial denture base. I place the wooden stick and place the other wide. Then you can see that the two are parallel to each other, parallel to the ala of the nose. I don't need to remove more, otherwise I will have a steep curve. Now I adjust the upper occlusion block, the anterior occlusal plane and posterior occlusal plane. The upper is ready now for mounting on the articulator. And we took before that mounting of the upper cast on the articulator is done by maxillary phase bone. Thank you.